Hi, my name is Isabel Garcia, and today I will be talking about tetanus. I will be talking about 5 main topics. The first one is characteristics about the disease, so if it's gram-positive or gram-negative, what the shape of it is, where it's found and where you can contract it, and how it can affect someone. Next, I will talk about the diagnosis, what are some symptoms of tetanus, and how medical personnel can tell you that you do in fact have it. And then I will talk about things to avoid and things to do. Then I will talk about the pathology of it, so if you do get it, how it affects your body. And then I will talk about some treatments, so when you do have it or if you do get it, what is the next step that you can take and how you can properly take care of yourself. So Clostridium tetani is the name for tetanus. It is commonly called lockjaw. Some history of it is that it dates back to the 5th century war zone. It was first produced in 1884 when pus from a fatal human case was injected into animals. Kita Soto isolated the organism from a human and showed that it could produce disease in animals in 1889, and also found that the toxin could be neutralized by antibodies. And then years later, in the early 1920s, a method was discovered to inactivate the toxin and then develop a toxoid. Some characteristics of the disease is that it is rod-shaped anaerobic. It is gram-positive spore-forming, and those spores can produce 2 toxins, which are known to cause the symptoms of tetanus and affect your central nervous system. Tetanus is in the kingdom Bacteria. It is in the genus Clostridium of the species Clostridium tetani. Some transmission, the ways you can get it, is through open cuts or wounds. It's with the needle, and it is found in the soil, the feces of animals, swimming pools, and oftentimes in dirty lakes and rivers. If your wound is not cleaned or treated properly, that bacteria can enter and then begin its life cycle, but it cannot be transferred from person to person, only through coming into contact with some of these environments. So, do you have tetanus? Here are some of the symptoms. The first one is lockjaw, so it's spasms of your jaw. Muscle tightening, trouble swallowing, your heart rate and your blood pressure will start to increase, and you'll develop a fever and start to sweat. In some of the most violent cases, you'll get bone breaks. It'll start to spasm your muscles so tight that your bones just can't take it anymore. When you go into the hospital or into a clinic, they will look at your symptoms and they will conduct a physical exam, and they will also look at your past immunization records to see if you have had the tetanus vaccine. And then they will also ask you where you have been within the past couple of days, so 7 to 10 days is the normal incubation time for tetanus. There are 3 types of tetanus. The first one is local tetanus, which is the most uncommon. It is persistent contractions of the muscles where the injury occurred. So say you have a cut on your foot, then your foot will start to contract more and more in the next couple of weeks before it subsides. The next type of tetanus is cephalic. It is a rare form and can occur with an ear infection or a head injury. The incubation time is 1 to 2 days, and your facial spasms are due to the cranial nerves becoming part of the disease. Tetanus will affect those nerves, and those could lead to facial paralysis, and this is the most dangerous form of tetanus. And then the most common form of tetanus is generalized tetanus. It is what is widely seen and occurs about in 80% of the tetanus cases that we see in the United States. Infants can also acquire tetanus. They can get it if their umbilical wound stump is not properly done and if the tools aren't clean. This normally doesn't happen in the United States. Some ways to prevent tetanus and what you can do. Make sure you stay up to date with your tetanus vaccines. Your first one should be given when you are 2 months old. Your second one you should get when you're 4 months. Your third when you're 6 months. And then your fourth is when you're between 15 and 18 months. You should also stay up to date with your tetanus boosters. So you should get your first booster when you're between the ages of 4 to 6 years old, when you're about to start school. And then you should get the next one when you're 11 to 12. And then after 12, you should get a booster every 10 years to keep up with it, to make sure you are cautious. And then you should also clean your wound immediately. And oftentimes when you're in the hospital and you do get a severe cut or wound, doctors will often recommend that you get a booster if it's been more than 5 years, to be cautious. And then you should also clean your wound right away. You shouldn't just say, oh, it's okay, I can clean it later. You should be safe than sorry. And then you should also stay up to date with all your vaccines and medications. So how can it affect you? When you come into contact with Clostridium tetani, you can often get it through an open wound when you come into contact with dirt, animal feces, and even sometimes dust. The bacteria then has spores that will germinate into your blood and produce 2 types of toxins. The toxins are tetanolaucin, which doesn't have much function to it, and then the second toxin is tetanospasmin. It is normally called the tetanus toxin, and it is what is known to cause the symptoms of tetanus and can attack your central nervous system. When you have the vaccine, your immune response is that when you get the vaccine, so you have some toxoids injected into you, and your body can produce antibodies that respond to the antigen. And then your adaptive immune response has immunologic memory. So if you do end up acquiring tetanus, your body can react more efficiently and more effectively against those toxins. So if you have it, what happens? When you go into the hospital, they're going to treat your wound, so they're going to clean it and take care of it, and they're also going to give you antibiotics for it. You will also be given the tetanus vaccine immediately when they have diagnosed it, and then you will also be given drugs and sedatives. Since muscle spasms are one of the main symptoms, they need to control those, and then you will also be given the tetanus immunoglobulin to neutralize those toxins. There was about 264 reported cases within the U.S. between the years of 2009 and 2017. There was about 60% of those cases were between the ages of 20 to 64 years old. About a quarter of them were people who were 65 years or older. And then about 13% were people with diabetes and who had immunocompromised symptoms, so their body couldn't react well enough to treat those symptoms. And then about 7% were from IV drug users that came from the needle, where the needle wasn't clean, or just different ways that they didn't take care of themselves. The most common places that tetanus is found, it's not normally found in the United States, but there are some cases that do occur. It is most commonly found in South Asia and the sub-Saharan African area. These places often don't have the means for vaccines, and they don't start off in the early years. So as an infant, you're not given your 4 rounds of vaccine. And then as children, you don't get those boosters since you don't get those vaccines. So they don't really have the means to take care of tetanus. And these areas are oftentimes not very clean. And so these places don't have the resources to properly treat the wounds. And so that's how sometimes tetanus is more common in these areas, because they just make do with what they have. And oftentimes this is where neonatal cases come into place, because when a mother is delivering, sometimes you don't really know if the area that she's delivering in is safe or if it's clean. And so she can contract tetanus, and then so can the infant if the umbilical stump isn't cleaned properly, or if they just don't have clean materials for it. Here are my references, and thank you so much. I look forward to some questions.